You know, some folks say that chiropractic is a pseudoscience. So what's the truth? Let's have an honest discussion about the profession. Hey folks, I'm Dr. Jeff Williams, and I'm the neuromusculoskeletal and orthopedic specialist here with our clinic. And I want to talk to you about something that gets searched for online way more than it really should be in this day and time. So let's get down to it. Chiropractic care is a form of healthcare and alternative medicine that focuses on the diagnosis and treatment of neuromusculoskeletal disorders, particularly those affecting the spine and joints of the body. Chiropractors are licensed healthcare professionals who have achieved a doctorate level degree and who use a variety of techniques, including spinal manipulation, to relieve pain, improve mobility, and promote overall health. Now, what is a pseudoscience? You know, we need to define the term pseudoscience. So pseudoscience is a set of beliefs or practices that are presented as scientific, but they've really got no basis in scientific evidence. Pseudoscientific claims, they're often based on personal opinions, anecdotes, or unverifiable data. When D.D. Palmer, the originator of chiropractic, when he first started creating and exploring this new procedure he called chiropractic, which means done by hand, this was back in the late 1890s. He was doing the same or similar treatment that the osteopathic doctors were beginning to perform just down the street. The cornerstone of this treatment was spinal manipulative therapy, which is still a big part of both chiropractic and still many osteopathic practices. However, much like the medical field that used to love lobotomies and leeching and bloodletting, a lot like that, evidence and research has now expanded. The medical field doesn't use that stuff anymore, right? And we, as chiropractors, have moved away from some of the original thoughts and thinking that began the profession of chiropractic. As the knowledge base has expanded, those chiropractors staying educated in the latest advances have expanded and grown as well, to the point now that the modern evidence-based chiropractor uses spinal manipulative therapy, but many other modalities as well, like targeted exercises, spinal decompression, cold laser, shock wave, soft wave, balance training, muscle work, strength and stability, functional movement, much more. And most of the techniques are actually recommended as first-line therapies for acute and chronic back pain by the American College of Physicians, which is the world's largest medical association, not chiropractic. And they made those recommendations based on the research that is in support of what modern chiropractors use. In addition, the Veterans Administration, or the VA, now sends veterans to chiropractors and the government pays for it. They do not make those recommendations based on pseudoscience, and the government doesn't send veterans to chiropractors all over the globe based on pseudoscience. They make those recommendations and they send those veterans based on solid randomized controlled trials, systematic reviews, and meta-analysis, high-level research. So why is modern chiropractic care not pseudoscience? Well, in addition to what I just told you, modern chiropractic care is based on the principle of evidence-based practice, which is derived from mountains of excellent randomized controlled trials that can be found in my book that I wrote called The Remarkable Truth About Chiropractic, The Unique Journey into the Research, which can be found on Amazon. This means that chiropractors use scientific evidence and national guidelines from the American Chiropractic Association and Clinical Compass to guide their treatment decisions. They also use a variety of research methods to evaluate the effectiveness of their techniques. Evidence supporting chiropractic care. Well, there's a continually growing body of evidence that supports the effectiveness of chiropractic care for a variety of conditions. These conditions include low back pain, neck pain, headaches, chronic, long-lasting pain, sports injuries, disc injuries, sleep disorders, arthritis, fibromyalgia, and so much more. So chiropractic care and traditional medicine, pretty good combination. Chiropractic care can also be used as a standalone treatment or in conjunction with traditional medicine. Here in my clinic, We have an integrated setup with a team of providers, medical providers, chiropractic providers, exercise technicians, massage, decompression. We've got acupuncture. We've got everything under one roof, basically, besides surgery. So, much like my clinic, chiropractors often work with other healthcare professionals, like the medical doctors, the mid-levels, like the PAs and the nurse practitioners, physical therapists, and massage therapists to provide comprehensive care for their patients. If you've been having a hard time feeling like yourself again, and you're ready to get better faster so you can reclaim your old life, why don't you call us at Creekstone Integrated Medical at 806-355-3000. Let's get you on the right path. If you're watching on YouTube or social media, we'd love it if you could share, subscribe, like, comment, and all the other good stuff. It really does make a difference. Until next time, stay pretty, and we'll see you then.